I'm Dr. J, one of the chiropractors from Chiropractic, and I want to welcome you to the latest episode of our educational video series. The topic of this episode is the slip disc. Now, the first thing you should know about a slip disc is how ridiculous the term is. It gives the impression that the entire disc comes sliding out of the spine, and that couldn't be further from the truth. You see, the disc is so firmly attached to the bone that if you try and pull it away from the vertebrae, you'll break the bone first. Here's what you need to know. The center of the disc is a fluid-filled ball. You can think of it a lot like a water balloon. This absorbs the shocks to the spine, much like the shock absorbers of your car or your mountain bike. Surrounding this fluid-filled ball, this nucleus, are a series of annular rings, so named because they look like the annular rings of a tree. Now, occasionally you can get tears of these annular rings. They can be perfectly painless. The condition is known as spondylitis, osteoarthritis, or degenerative disc disease. If we get enough of those tears, what's going to happen? Think about our water balloon. If I squeeze it in my hands, it's going to push out through any little gap that it can. The same thing will happen with the nucleus of the disc. It will push out through those tears. That is what a slip disc is. So I think you can see why the term slip disc is such a poor one. The better name is disc herniation. And I think you can see that disc herniations don't just come out of nowhere, they take time to develop, usually years. Now, the question that's probably running through your mind now is, where do these tears come from? A lot of people would understandably assume that it's part of the aging process. That's not true. You can actually see these degenerative changes in teenagers sometimes. And on a regular basis, we'll see examples where one disc is completely degenerated and the rest look perfect. All the discs are the same age, so why aren't they all degenerated the same amount? You see, the disc gets its nutrition through movement. If the spine is immobilized through trauma, that disc won't be fed, and that starts the degenerative process, starts the tearing of the disc. The trauma can be a single one-off, like a car accident, or it can be many little traumas, like poor posture. Now, this is where chiropractic can come in. Through chiropractic treatment, we can get mobility back into the spine. Then the disc will have its supply of nutrition and slow or possibly halt the degenerative process. If the disc herniation has already happened, then chiropractic can still help get you well. So that's disc herniations in a nutshell. I hope you found this helpful. Check out our video series on www.purechiro.ca for further information. I'm Dr. J, helping you get back to life.